Okay, so I want you to picture this. You're at home, you're sick, you're lying on the couch in your PJs and you're sobbing and crying, and the last thing you want to do is get up, get dressed, and go to the doctor. Wouldn't it be great if the doctor could come to you? Well, guess what? They can. I want you to meet Rebecca Rocco. She is the marketing director for DispatchHealth, and she is joining us this morning to explain how this service works, because this is important, Rebecca. You really want people to understand you're an urgent care. You describe it.
We're a mobile urgent care provider, and we do some minor emergent care as well.
Okay, so that's a tough one to wrap your head around.
It is.
Urgent with minor emergent.
Right.
So what does that mean? Who should call you?
So we actually have a team that comes to the home or the office or the soccer field or wherever.
Wherever.
They're a PA or an NP, a physician's assistant or a nurse practitioner, and an EMT.
Okay.
So typically someone who is trained as an EMT, been on an ambulance, things like that. So they come together as a team. They're not physicians, but we always have an ER physician that has virtual oversight every single day.
Okay.
So they're coming to the home. They are seeing things like flu, migraines, UTIs, minor fractures, lacerations. We can take care of all of those things right in the home.
So when someone calls in, what immediately happens is an assessment by your team to determine, and you actually code them in colors.
Right.
Explain that to me.
So we have a proprietary software program that was designed by an ER physician. It does what's called risk stratification. So we're looking at the chief complaint and the risk associated with that chief complaint.
Okay.
And we look at it in three ways. So as we move through this platform, green, based on our conversation, means we can come and see you. We're going to give you an ETA for your team and let you know when they're going to be there. Yellow means we're looking at a scenario that we probably want to speak to a physician about and do what's called a secondary screening with one of our physicians.
Okay.
Red, we know based on this conversation that you need to go to the ER, and we're going to tell you need to go to the ER.
Yeah, you need to hang up and call 911. Okay. That's what's important, because you don't want people who are feeling like they're possibly having a stroke call you, right? You need to go to the ER. So these mobile units you have, and yet generally when we're not feeling well, there's a window. We want to know, how quickly can you be there? How quickly can you be there?
So we're typically we're on scene in 1 to 3 hours.
Okay.
But when we're with our patients, we are in that environment for 50 minutes.
Wow.
So I like to say, when was the last time you spent 50 minutes with your primary care provider, number one? And
saying that, meaning you don't do primary care.
We do not do primary care.
So insurance accepted?
Yes.
Okay.
We bill insurance, no financial transaction on the front end. So we're capturing all that information in that phone call.
Okay. And in addition to that, you're also able to do some lab work and things like that.
We have a CLIA certified lab.
Yes.
We have a CLIA certified lab on board. We also have a formulary. So we can administer a first dose of medication, and then we send that prescription on to your pharmacy right there on site.
Okay. Very quickly, I want to know, who is the perfect candidate to reach out to you? The phone calls that you're getting that are really helpful for people.
Well, we see ages 3 months and above. So it could be a mom at home with 5 kids that doesn't want to drag all of her children out to the urgent care.
Right.
It could be the senior in the senior living facility who doesn't have the wherewithal to get to the ER or the urgent care.
Okay.
It pretty much runs that gamut. Or it could be the person who's in a bike race who's fallen off their bike. We've actually treated someone on the soccer field in a bike race, so we'll go anywhere. The CEO in his office.
What a great idea. I want to thank you so much for sharing.
Thanks for having me.
Yeah, it's a wonderful opportunity for those who can't get to an urgent care. Here's what you can do. You can give DispatchHealth a call. Here's that phone number. Write this down, put it in your phone, 480-493-3444, and you can learn more about the services that they offer. Visit the website dispatchhealth.com.